Distinguished and generous speaker for today, Dr. K.S. Sriprakash, former Vice Chancellor, Rajiv Gandhi University of Health Sciences, and Managing Director, Shri Eye Care Hospital. Sir completed his MBBS and MS from Bangalore Medical College and went on to receive his vitreoretinal training at Wills Eye Hospital in USA. He has worked as the director for the Regional Institute of Ophthalmology at Minto Ophthalmic Hospital, Bangalore. He has performed over 12,000 cataract surgeries and worked in various fields such as retina, cornea, glaucoma, squint, pediatric and community ophthalmology in a career spanning more than 40 years. He has delivered more than 65 presentations at various national and international conferences and has numerous publications in index journals. He received the Asia Pacific Outstanding Award for the prevention of blindness at the World Ophthalmic Society Conference in Tokyo in 2014, and has also received the Indira Gandhi National NSS Award from the former President, Mr. Pranab Mukherjee, during his tenure as Vice Chancellor. But beyond any of this, Sir is one of the most profoundly curious learners and an immensely passionate teacher, and we're honored to have you here today, Sir.
Thank you, Sana, for the nice introduction. And thanks for the invitation. I thank organizers from IMA, MSN, Karnataka. Today we are going to discuss on eye donation, which is a very important topic of social concern. We are going to discuss on how eye donation can address issues of corneal blindness, the effective role of eye banks, how to influence and improve awareness amongst common public. Let's take a look at what is eye donation. Eye donation is an act of donating one's eyes after his death. It's an act of charity purely for the benefit of the society and is totally voluntary. It is done only after death. The eye donation of the deceased can be authorized by the dearest family member. Why eye donation? There is no better alternative to human cornea other than donated eyes. Artificial cornea is still under research. After transplantation, 90% of success rate is seen in patients. Where we are going to use the eye, this is going to benefit those individuals who are blind due to corneal diseases. One pair of eyes can give sight to two corneal blind. The other portion of the eye, like sclera, it is used for ball and socket reconstruction. And if the eyeball is not used for transplantation, it can be used for teaching and research purpose. Let us take a look at this picture. You know that, you all, as medical students, you all know that the anterior portion is a transparent layer called cornea through which light passes and it is focused on the retina. Any loss of transparency of this structure, it's going to produce corneal blindness. Let us enumerate the causes. These are the many causes which, as medical students, probably you would have come across. There are many causes which can produce corneal opacities like infection, injuries, malnutrition, and there are iatrogenic causes also. The infection, particularly due to bacteria, viral or fungal, it can produce corneal ulcers. With or without hypopionate, it can lead on to further opacification of the cornea and decrease the vision in the eye. Injuries also can damage the corneal curvature, and it can produce opacities resulting in corneal blindness. Of course, nowadays we are not seeing many cases of secondary to malnutrition, but about 3 or 4 decades back, we used to see at least minimum of 5 to 6 cases coming to our OPD with keratoalacia, which is due to vitamin A deficiency, and unless if it is not treated with vitamin A injections immediately, the entire will melt off. How to cure corneal blindness? The diseased cornea is removed, and whatever that from the donor cornea, the same cornea is replaced. So you can see here, the diseased cornea is removed and it is replaced by the donor tissue. The procedure, what is done is called as corneal transplantation. So either we can do a full thickness penetrating keratoplasty, or a partial thickness of the donor cornea can be used, both as anterior and posterior type of keratoplasties. Let us understand the magnitude of the problem because of the corneal blindness. In India, we have 4.6 million corneal blind. 90% of these patients are below 45 years, and 60% of them are children below the age of 12 years. 3 million patients, corneal blind patients, can recover their vision through corneal transplantation. But currently, it has become possible only to do around 25,000 corneal grafts per year. Let's also take a look, on the other hand, we have got around 9.5 million deaths happening in India every year, out of which only about 50,000 eyes are donated. Demand is almost 1 million a year, 1 million eyes per year. Particularly, probably the demand is so high, but the supply is so less. We can think that this attitude is mainly due to lack of concerted effort on a national scale by professionals, government, NGO, and civil society at large. Let's take a look at what India needs. We require almost around 80,000 transplantations per year, or little more than that. We need to have 2,000 eye donation centers, and we need to have corneal retrieval centers at least in 500 hospitals, and we need to have 1,000 cornea specialists. Though we have more than 500 eye banks, the fully functioning eye banks we see only to 50 to 60. Let's take a look at who can donate. For eye donation, there is no age bar. Very young to old, even up to 100 years, they can donate. Patients, people with diabetes, hypertension, asthma, they also can donate as long as cornea is very clear. In certain cases, eye collection is different. If the patient has an active systemic infection like bacterial, viral, or fungal infections, viral encephalitis of unknown origin, rabies. If the cause of death is not known, cancer with metastasis to head and neck, leukemias, and lymphomas. In these patients, we are not going to collect the eyeballs. Eye donation is very simple. It is done only after death, preferably well within 6 hours of death. Collection of eyes can be done at donor residence, hospital, mortuary, or even at the crematorium. There won't be any delay for the customary funeral, Eye collection can be done well within 15 to 20 minutes. And very importantly, no disfigurement of face, as many a time only the cornea is collected. Let's see what to be done after death. Eyes to be collected well within 6 to 8 hours of death. So this point you have to keep it in the mind. So elevate the head of the deceased by pillows and close the eyelids. Switch off the fan if present above the body. It's important that you should not allow the ocular surfaces to be dry, get dried. You should keep ice packs, wet cloth to be placed on the forehead. Inform the eye bank immediately. It's also important that you need to get a death certificate. What are eye banks? Eye banks are government registered body. They are non-profit organizations. The functions are mainly to collection of donor eyes, evaluation of the corneas, and they have to distribute to the hospitals where eye transplantation can be done. They also have another important role. They need to educate the community, particularly regarding the corneal blindness and eye donation. In India, the first eye bank was started somewhere in the year 1964. Lions International Eye Bank is one among them, started in the year 1984. It's also affiliated to International Federation of Eye Tissue and Bank at Baltimore. I already said that we have more than 500 eye banks in India. Eye banks, they follow certain ethics as per the Transplantation of Human Organs Act 1994. Donated eyes cannot be misused as they come under this act. Donor and recipient confidentiality has to be maintained. Eyes are never sold or bought. Once the eyes are received, further processing is done at the eye bank. They need to evaluate the vitality of the corneal tissue. They use a slit lamp by microscopic examination to assess how the corneal condition is. They also examine the endothelium by using a specular microscope. Once the eyes are evaluated, they have to be preserved for some more time. We have got the short-term preservation and long-term preservation. The idea of preserving the cornea is mainly to see that endothelium retains the function and at the time of transplantation. As I said, why it is very important to look at the endothelial cell count. So if the cells are more than 3,000 cells per cubic millimeter, it is an excellent cornea. It is very good for corneal transplantation, and the results will be very good. In any case, if the number of cells are less than 1,000 cells per cubic millimeter, the results will not be very good. Pledging is not a must for eye donation. Any relatives in the family who is very close to the deceased can always donate the eyes. Let us look at these facts. One is for eye donation, publicity is not sufficient. Elders, they are not aware about this eye donation at all, particularly in the rural areas. And if there is a role for family doctor who can always link with the relatives and the patients, and they can always explain about the importance of the eye donation. More than that, there is also what is called as religious taboo in the Indian scenario. I just want to share a particular, about 3 to 4 decades ago, when I was working as a faculty member in one of the premier institutes, We used to do few corneal eye transplant surgeries. And for this, the eyes, the donated eyes used to come from Sri Lanka. And we used to get 3 or 4 eyeballs from Sri Lanka every week. And that used to be uh, donated. That used to go to many hospitals in Bangalore and in entire Karnataka. We used to get 1 or 2 eyeballs. And by the time we used to receive it, it used to be around 6 o'clock in the evening. And we used to take the patient for surgery much later. Why I'm telling this is that was the kind of situation we had around 3 decades back. And we never used to see any donation occurring in the in either in Bangalore or in any parts of Karnataka. Why in the entire India alone? So let us take a look at how doctors can help in eye donation. Doctors can form an important link between the eye bank and public. Patients always trust their family doctors. They form important part of their family. So families always follow the doctor's advice. I also would like to tell the role for medical students. They have a special role to play. They need to take the pledge to donate the eyes. They can raise awareness through social media. They can work towards fighting taboos. You need to communicate to your friends and family members and encourage them to donate, to go for eye donation after pledging.
Have thorough knowledge about and provide information about their eye banks. I would like to mention few celebrities. Here are many popular icons of our country who, by pledging their eyes for this noble cause and spearheading awareness campaign. I'm sure you're all very familiar with this picture, Dr. Rajkumar, who is the Kannada cultural icon and the legendary actor from Karnataka, who pledged and donated his eyes for this noble cause. He was the ambassador for eye donation campaign and brought a very good movement and public awareness for this noble cause. During his lifetime, an eye bank was started by his name and it is functioning very successfully. After his death, there was an overwhelming response from his millions of followers who participated in pledging and mobilizing eye donation. Remember, eye donation can be done only after death. Eye pledging is not a must for eye donation. Eye collection can be done only within 15 to 30 minutes. Anyone can donate eye even if they have undergone cataract surgery, if they have got diabetes, hypertension, or due to old age. Collection of eyes can be done at donor residence, hospital, or charity, or even at the crematorium. One very important thing one should remember is one pair of eyes gives sight to 2 corneal blind individuals. Helen Keller was an American activist, author, and educator who became deaf and blind at the age of 19 months. She was the first one in the United States of America to graduate from college while deaf and blind. Her ideas were mostly expressed in her work, most notably her autobiography, Story of My Life. Helen Keller Deaf Blind Awareness Week is observed every year to elevate consciousness about deaf blindness. This year's theme is Deaf, Blind, and Thriving. In the spirit of this week, I urge everybody to take the pledge to donate your eyes and give sight to 2 people. Here I am providing a list of nearest eye banks, which is all over Karnataka. And in Bangalore, we have the Regional Institute of Ophthalmology, where I have worked. Then Lions International Eye Hospital, Eye Bank, Bangalore. We also have Dr. Rajkumar's Eye Bank, situated at Narayan Nethralaya, Bangalore. So with these few words, I think I have so these few words, I think that it has become, it was possible for me to have to summarize on eye donation usages, something on the eye bank, and what is the magnitude of the problem we have, how important it is for us to go ahead and create awareness as well as pledge our eyes. Thank you. If I have any questions from your side, let us take it.
Thank you so much, sir, for the wonderful talk on eye donation. I'm sure a lot of us learned many things that we did not know before. So moving on, we are collaborating with the Lions Eye Bank for the pledge drive so we're going to be sharing a link on the chat box as well as the WhatsApp group as well as on Instagram. And you can put in your details and you can, so the link is here. So you can pledge, you can complete the pledge. And once you're done, you will be receiving a pledge card on your email and you'll also be receiving a certificate. So once you're done, you can tag 3 of your friends on Instagram, or basically the idea is to share the message and increase awareness about eye donation. So it would be great if you could do that. And if you have any doubts, you can text any of us. While everybody is filling the pledge, if you have any doubts, you could unmute yourselves and ask your queries.
Am I audible?
Yes, Rasha, you're audible.
Hi, everybody. Zainab, we can't hear you. Also, I think because there is so much traffic to the link at once, that's why it is not reachable. The link will also be shared on the WhatsApp groups and on Instagram, and you can access it then again. I will reshare the link again.
All right, guys, don't worry, you will be able to access the link. So we're going to be sending another link. It's basically the post-event form, and there's a short quiz on the session that was held right now. So it will serve as both your certificate form as well as a small quiz to test what you learned. So you can fill it up, and once you submit it, so basically only if you submit it, you will get your certificate. So please make sure you fill the form.
Hi, everyone. I think no questions are there. If no questions are there, maybe I would like to thank organizers, IMA, MSN, Karnataka for inviting me to talk on this noble cause. My earnest request to all the medical students who have participated in this program to not only pledge your eyes, but also take care of initiating awareness and spreading importance of eye donation to your family members, friends, and through social network. Reach out to every citizen of this country. So I wish you all the best. Thank you once again.
Thank you so much, sir, for accepting our invite. And thank you to all the participants for joining us today. We also have another webinar tomorrow. Please do make sure you log in on time. And regarding the pledge link, we will make sure we share it again on the WhatsApp groups as well as on Instagram. We also have a post on Instagram where you can tag your friends and spread the message. Thank you so much. Please make sure you fill the post-event form. It is on the chat box. And please make sure you fill the quiz and you will receive your certificate shortly. I also want to thank Mithun for all the support that he has given us, Meghna and the entire team, especially Nitin, Abhishek, Veeti, Ishan, Ila, everybody else, Chaturya, everybody who gave us their support for the event. Thank you so much, everybody. And we'll be ending the meeting now. Thank you.